I want to thank you for allowing me to present my information at this research conference. My study is actually a combination of two studies, so I want to at least get that information out there. What I had done as a stroke healthcare professional back in the early 2000s, I was part of a core group of stroke healthcare practitioners that oversaw the care of the acute stroke patient in the state of New Jersey. And what we identified, the name of the group was the New Jersey Stroke Coordinators Consortium. What we needed to do is figure out a way to unify the care throughout the state, because once the group originated, we found out that nobody was doing the same thing. And any of the sites that were designated as stroke centers, we needed to follow specific protocols, specific care to provide to the patients to enable the best possible outcome for the acute stroke patient. So in 2009, the Stroke Coordinators Consortium was identified. There were over 40 hospitals, 2 rehabilitation facilities. We worked directly with the American Heart, American Stroke Association, as well as the New Jersey Hospital Association to coordinate the effort. We were hoping for future participation from the New Jersey Department of Health, because at that time, the Department of Health in the state of New Jersey was not truly involved in the care of the stroke patient, but they were building towards that. The majority of the attendees in the consortium were stroke coordinators with over 40 members. We had over 40 members at the time of inception. There were other healthcare professionals, stroke healthcare professionals involved in the consortium, such as nurse educators, performance improvement coordinators, and directors and administrators of stroke programs. The New Jersey Stroke Coordinators Consortium was considered a multi-institutional collaboration effort for acute stroke to manage the care in one format throughout the state of New Jersey and to be able to provide education to the communities. What I had done was, being a stroke healthcare professional, I realized, and being part of the consortium, the hospital that I was working at, that I was running a stroke program for, really had no organization as far as the management of care of the stroke patient. And the care actually revolves around the documentation of what we do as nurses for managing the stroke core measures, and the stroke core measures being established by the Brain Attack Coalition, the Joint Commission, and the American Stroke Association, all realize that this is what needs to be done for the stroke patient to have the best outcomes. So like I mentioned, this study that I'm presenting today is a combination of two. Mine, and then my recommendations were then followed through by Dr. Varsha Singh, who actually developed a process to help the rest of the care providers to gain insight into what was needed. And I'll get into that in a few moments. Both of these two studies were doctoral dissertations. Mine was from the University of Medicine and Dentistry of New Jersey, which is now merged as Rutgers University. Dr. Singh's was from Seton Hall University. The convenience sample that was utilized was the member of the group that both of us were part of, the New Jersey Stroke Coordinators Consortium. And the need was to manage the care effectively throughout the state. My study was published in 2014, but it was completed in 2010. And the premise of my study was to determine the effectiveness of the processes and the guidelines that the staff members of all of the facilities in the state of New Jersey were following regarding the care of the stroke patient. I looked at primary comprehensive stroke centers, as well as the centers that had no designation at all. My study also looked at the perceptions of care. How did the stroke healthcare professionals, the nurses, the advanced practice nurses, the bedside nurses, the stroke educators, how did they feel? Were we doing the best job that we possibly could? Dr. Singh's study, which was the scope order pathway education for APNs, And she highlighted the need for educating the advanced practice nurses, and she emphasized the importance of using specific education processes and order sets to improve the quality of the care of the acute stroke patient. She also looked at clearly defining the role for the advanced practice nurses, because as we all know, advanced practice nurses in the healthcare facilities may not be very knowledgeable about the specific care that is required for the acute stroke patient. So the nurses at the bedside were now learning this information, but they needed somebody in addition to themselves to be able to initiate the process. Dr. Singh's study was conducted in 2017. I tried to find some literature to guide me when I started my study in 2009, 2010, but there was no statewide literature for New Jersey evaluating the stroke practices prior to 2010. My study was the first one that was done, and since that time, there have been several other studies, most of them through the Stroke Coordinators Consortium, that have been conducted regarding the care of the acute stroke patient in the state of New Jersey. So it appears that this is an ongoing issue, and we're always seeking ways to improve the care of the stroke patient. What I had done was I collected information on both the primary stroke centers, the comprehensive stroke centers, and hospitals that did not have any stroke center designation. Collecting this type of information enabled me to see the differences in the compliance rates, because even the centers that were not designated as stroke centers, they still needed to provide a specific level of care to the acute stroke patient so the patient's outcomes would be beneficial. My study actually included 40 hospitals. There were 32 primary stroke centers. Of those, 6 comprehensive stroke centers and 2 hospitals that had no stroke center designation. Each of the hospitals that were designated as stroke centers when I had conducted my study were either primary or comprehensive by the Joint Commission, the DNV, or the New Jersey Department of Health and Senior Services. The minimal education requirement was Bachelor in Nursing, a BSN. The majority of my participants were stroke coordinators, and there were also some program administrators and stroke managers. The theoretical framework that I had used was Donna Bedian's quality health outcome model. The health outcome model looks at the structures, the processes, to see if they are providing the effective outcomes that were identified. And my adopted model actually included all of the framework that Donna Bedian's model included. It was all about documentation. Whenever we identified a lack of documentation, where we were not measuring up to where we needed to be, providing the highest level of care, it was all about, as nurses, if it's not documented, it's not done. But the problem being, many of the nurses did not know what was needed, especially the advanced practice nurses. So what I had done with this slide, I looked at the specific items that basically were lacking, and each and every one of those needed an order to be included in the care process. And the staff nurses cannot write the orders themselves. The advanced practice nurses are what we really needed to be able to be on board to bring the level of care up to a better level than what we were doing at that time. Now, as you see, we used Quadramed, which was our data analysis tool. The certified stroke centers under discharged on antithrombotics, under lipid panel by end of day 2, and dysphagia screening, the numbers may not appear that bad, but if you are looking at the actual care of the acute stroke patient, we needed to be at a higher level. So even if we were managing at 93% for discharging a patient on a specific medication, we still were not meeting benchmark. So we all knew that we needed to improve the process, but it wasn't identified how we were going to do it at that time. When I identified lack of education as the barrier providing the highest level of stroke care, what I wanted to do was I wanted to bring in another level of care to the patients. But how do we do that? Who do we get to be able to provide this highest level of care? Who do we educate to be able to say, all right, this is where we are, this is where we need to be, and this is what we need to do next to be able to move ahead in the process. And it was identified that process changes needed to be put into place. And this had to be done across the state, not just in 1 or 2 stroke centers, because when we're looking at the data, we're looking at the aggregate data for the entire state. And if one hospital does better, but the others do not, we're not really doing the best that we can for the acute stroke patient. What I identified was that the advanced practice nurses are actually the frontline staff, not necessarily just in the emergency room, but also on the floors to help the staff, the nursing staff that cannot write the orders themselves, to be able to provide the highest level of care, to get the prescribing capabilities. For the acute stroke patient, the advanced practice nurse may be the initial contact when they first come into the hospital, or when the patients who are admitted for another medical condition have an acute critical event while they're in the hospital. Again, the advanced practice nurses may be the first one that they call with the rapid response team. Having an APN on the front lines does enable the stroke core measures to be initiated at the first sign of stroke. So this is where I was now going with my ideas for continuing the education. In order to bridge the gap, what I had initially done was I spoke with the emergency room staff and found out that yes, there is an APN there. However, they don't know what to do. They are not knowledgeable on the care that is specific for the acute stroke patient. And as hospital staff, we enabled the stroke core measures to be initiated at the first sign of stroke, whether it's inpatient or in the emergency room. So we started to bring the advanced practice nurses in on the ground level. Combining these strategies created an evidence-based stroke education initiative for the advanced practice nurses, and this is where Dr. Singh comes into play. The Stroke Clinical Order Pathways Education, or SCOPE, for advanced practice nurses was initially identified as a quality improvement process that Dr. Singh had utilized for her doctoral dissertation. She conducted an education process for advanced practice nurses. She held several sessions over a 4-month period between November 17 and February 18. It included a pre-test, PowerPoint presentation, post-test, and a post-session evaluation. And what she was trying to do, she wanted to emphasize the importance of utilizing a specific education process to improve the quality of care for the acute stroke patient, highlighting the APN's availability to be able to work with the staff nurses and be the front line for the care. Dr. Singh's SCOPE education process had participants 55, 28 advanced practice nurses participated, and there were 21 registered nurses that participated. And what we found out from the registered nurses is they were bringing this information back to their facilities to enable the advanced practice nurses to see that they could have a greater impact on the care of the acute stroke patient. The theoretical framework that Dr. Singh used in her study was Benner's novice to expert. And it is identified that the more the nurse learns, the more times they practice, the more times they utilize something, their level of competence, their level of knowledge increases. So if we put the education process out there for them, if we teach the advanced practice nurses what is needed for the care of the acute stroke patient, bring them in on the ground level, this will enable the patients to receive the treatment quicker and to manage the care in a more effective manner. Dr. Singh's information showed it was all about the education. The participants in her study, basically, they identified that it helped them to learn about the processes. They identified that they knew what measures needed to be initiated. They had a greater knowledge of the measures that needed to be initiated. They identified that their level of competence increased after the education process. And when they went back to their individual sites, they were able to step up and assist with the processes in a more manageable manner, instead of just standing in the background and waiting for somebody else to say, okay, this is what we need, let's get these orders done, let's provide the care to the patients. As the stroke APNs realized that they may be the initial contact for the acute stroke patient, we needed to make the facilities aware that the APNs, as frontline staff, having the prescribing capabilities, instead of waiting for somebody to call us back, to call a staff nurse back to be able to provide the orders, and getting the facilities to identify that and permit. Some of the facilities did not do that in a timely manner. But when they saw their statistics for management of care, and they see that they are not providing the highest level of care, it was a little easier for them to change their processes and permit the advanced practice nurses to come to the forefront as soon as an acute stroke patient is identified. Advanced practice nurses may function as an expert and an educator for new hires that come in. So this way, the same quality of care will be provided to our patients across the board. There was some post-education that was provided, and all of the participants in Dr. Singh's study stated that they then had an increased awareness of what the care required for the acute stroke patient. They had a greater understanding of specific order sets and the rationale behind initiating all of the care in a timely manner. It helped them to develop their role as a critical thinker and a leader in the provision of stroke care, which is very important to any of the acute stroke patients, as well as the primary and the comprehensive stroke centers. Increasing the confidence actually supported the clinical order pathways with the advanced practice nurses. So they were able to, once an acute stroke patient is identified, just step right up and begin the process, sometimes even before the patient came into the emergency room. And this enabled the facilities to meet the compliance for stroke care. So what has been recommended by Dr. Singh and myself is to develop an education process to elevate the level of knowledge for all of the advanced practice nurses across the state for care of the acute stroke patient. And this will enable the advanced practice nurses to move along Benner's novice to expert and get a greater understanding and feel more comfortable and confident in the provision of care. We do recommend that future studies to evaluate the effectiveness of the scope education process is recommended. And I would also like to repeat my study to see, once all of the education has gone out there, are the perceptions of care any different from the staff that is at the bedside for the acute stroke patients? One of the limitations to my study was the lack of available literature on prior practices for stroke care. So unfortunately, that limited my ability to compare to what the current practices were. What I had done was I looked at the compliance with the guidelines for care from the Joint Commission, from the State Department of Health and Human Senior Services, I couldn't even get the name out, as well as from DMV, because each of those organizing bodies have a different set of standards, but we all have to follow the American Heart, American Stroke Association, and the Brain Attack Coalition standards. Another limitation that I had was there were 2 non-certified centers that participated in my study, and this may not reflect the true findings of the care that was provided or the perceptions of care at the centers that were not designated at the time that I had done my study. Collecting data on such a small group of facilities does not represent their true practices, their true processes, or possibly the true outcomes of care. Limitation with Dr. Singh's study, she provided her education, her scope education at 4 different sites. Her sample size was small, 28 were participating. However, it was identified that this was a tremendous opportunity to revise and refine the education process on an individual basis according to the different facilities, because each facility has a different process that they follow. And we also included the feedback and the responses from the participants with the survey that would help each individual facility to fine-tune their education process. Ideally, scope as an educational process across the state of New Jersey should be instrumental in creating a standardized order pathway, a standardized educational process for the stroke healthcare professionals that will enable the healthcare organizations throughout the state to manage care on a more uniform process. The next steps, like I had mentioned, I would like to do a longitudinal study investigating whether the changes in the perceptions of care have improved over the last 10 years. I have gotten approval by the New Jersey Stroke Coordinators Consortium to repeat my study. So that is something that I am currently working on. Dr. Singh is working to continue the APN education throughout the state. She has provided her education process to many different facilities throughout the state. And something that I want to add that it is not on the slide, when I have been presenting this information to regional, local, national, and international venues virtually, I have gotten inquiries from many different states and countries on, please tell us what you do and how you do it so we can do something like this where we're located, which has really enabled myself and Dr. Singh to realize that this is something that is needed across the board. Next steps. I am currently published in the Journal of Neuroscience Nursing back in 2014. Dr. Singh has published her information, her study, in the Seton Hall DNP Final Project. She is working on identifying a journal to publish her study in, and then I am looking at an appropriate journal to actually publish our combined information. This is a presentation of the PowerPoint that I have developed, a poster that I have developed that I have used in many of the presentations that I have done. I have presented both poster presentations as well as keynote and focused presentations such as this one. I want to thank everybody for allowing me to present the very important information regarding the care of the acute stroke patient. This information does not change. The need is out there. The need is always going to be out there. We just need to get everybody on the same page so the acute stroke patient receives the appropriate level of care. Thank you.